introduce our speaker tonight. Actually, first I'll introduce myself. My name is Dr. Colleen Ehrlich. I am the immediate past president for the Colorado Association for Gifted and Talented, and it is my pleasure to introduce Julia Rutkovsky. Did I say that right?
Yep.
Yes. Okay. LCSW. She is a clinical social worker and psychotherapist who specializes in working with neurodivergent, twice exceptional, and LGBTQ plus children, adolescents, and their families. Julia's practice provides individual, group, and family therapy, as well as school consultation and provider training in New York and New Jersey. Julia received her BS in social work and theater from Skidmore College in 2016 and her Master of Social Work with Honors from New York University's Silver School of Social Work in 2017. In addition to her LCSW, Julia holds advanced training in child and family therapy, certificate in meeting the needs of twice exceptional children, cognitive behavioral therapy for anxiety and OCD, foundational dialectical behavioral therapy for children and adolescents, and mindfulness. Wow. She is SIFI certified and has supervised several MSW interns from NYU. And you can find out more about Julia's ongoing information at juliarutkovskylcsw.com. So thank you so much, Julia, for being here tonight. She is going to be speaking with CAGT about the intersection of queerness and giftedness. And this workshop will discuss the intersection of queerness and giftedness, how gifted people experience their gender and sexuality, and the ways we can use this knowledge to better serve queer and gifted people as clinicians, educators, parents, and community members. So with that, welcome, Julia, and we're so excited to have you.
Thank you. Hi, everyone. I'm Julia. It's nice to see all of you live or in the recording if you're watching this. And I'm going to talk a little bit today about the intersection of queerness and giftedness, particularly in children and adolescents. Um, this is a little bit about me. You already heard from Colleen, but I'm a clinical social worker. This is sort of my niche population of interest. I'm also currently working on a book about how to support neurodivergent and queer adolescents in schools, which I will give you a little link to at the end. Before we sort of get started, I always like to define a couple of key terms that you're going to hear me use to make sure we're all sort of on the same page. These are the terms that I'm using most often when I'm talking with children and adolescents about their gender and sexuality. So someone's gender identity is sort of their sense of self or the way that they identify as it relates to their gender. So somebody might identify as male, as non-binary, as genderqueer, as female. There's lots of different words that they can use to identify their gender. Gender identity is not, however, exactly the same as gender expression, which is the way somebody presents to other people. So the way that somebody expresses their gender might be in line with what you assume they will express like for the identity that they identify with, and then it may be different than what your assumptions are. So I like to keep those things separate. When we're talking about someone's sexuality, we're talking about their sexual orientation or who they're interested in sexually. A lot of times the children and adolescents that I work with really separate that with their romantic orientation, depending on what point in their development that they're at. Romantic orientation being who you're interested in having romantic relationships with. Some people distinguish their sexuality and romantic orientation, some don't. But those are some terms that you will need to know for the rest of the presentation. I also wanted to take a brief moment to just mention that I'm going to focus mostly on giftedness today, but there certainly is a whole other presentation I could give about the ways that queerness and neurodivergence intersect, and certainly neurodivergence and giftedness intersect a whole lot. You may hear me use the phrase twice exceptional. That refers to someone who is neurodivergent, but who also has like a profound gift. I love this image from the lived experienced educator of like what could be considered neurodivergent. It's really an endless list. But if somebody identifies as neurodivergent or has one of these diagnoses and they're gifted and talented, they may be referred to as twice exceptional or 2E. And so I may mention, just some facts about 2E and queerness, and that's who I'm talking about. So, approximately 30% of gifted children identify as LGBTQ plus. That's the most updated stat we have out there. Certainly, it's a fairly under-researched number. So, my guess is that it's a higher number. If we were to really if we were to look at it a little bit more closely, or if we could account for children who maybe don't feel comfortable sharing that part of themselves yet, but at least 30% of gifted children identify as LGBTQ. And that's a pretty significant percentage. We also know that gifted and 2E children have asynchronous development, and they may explore their gender and sexuality earlier or later than their neurotypical peers might. And so if you are a provider or a parent who's working with a gifted child, you have to be prepared to have this conversation both earlier and later than you might expect to have it based on like someone's age or their developmental level. It's really important that we're having the conversations about sexuality and gender with kids at the level that they're at. So, if a 8-year-old walks into my office and they're talking about their gender and sexuality at an 11th grade level, that's where I'm going to go with them. And at the same time, if an 11th grader walks into my office and is talking about their gender sexuality at a 5th grade level, that's also where I'm going to talk to them about it. It's really important to be sort of on their level about this, but to know that like it is normal and expected and perfectly acceptable for gifted and 2E children to be exploring their gender and sexuality at what might seem like the unusual time. Why is queerness more common in gifted people? There's lots of different reasons for this and lots of different theories. The biggest overarching theory is that gender and sexuality are something that requires higher level thinking. So if you're thinking about neurotypical children, they have to get to a certain cognitive level to be thinking about their gender and sexuality. They may not think about it in the same way when they're 6 as they do when they're 10, as they do when they're 14. If your child is thinking at a higher level, or they're thinking about more mature concepts, or they're maybe like a little bit cognitively precocious, it's likely that they're going to start thinking about gender and sexuality. And so gifted people often start to think about those things earlier and in more depth. And then we know that gifted learners have the propensity for questioning and really thrive in exploratory learning environments. And gender and sexuality are all about exploration. So the topic of gender and sexuality I found in my work can be really stimulating to a gifted brain, can be more intriguing to a gifted child than it might be to a neurotypical child. And there's a lot of questioning and exploration that goes into thinking about your gender and thinking about your sexuality. And that just comes even more naturally to our gifted learners, particularly the questioning piece. Like if you're going to be exploring your gender and sexuality, you sort of have to start with questioning, because many children and adolescents, and I'm sure many of the people watching this, we're sort of taught that we're supposed to be one way, and we have to question that if we're going to explore gender and sexuality and find sort of our authentic identity. So being able to question social norms, being able to question what everybody believes, being able to question what all the other kids are doing, it's a much more common like cognitive skill for gifted kids, and is necessary if you're going to explore your gender and sexuality. Gifted kids are also more comfortable with sort of like ambiguity and living in the like, we don't totally have the answers, but we're learning about something. It can be really confusing for a neurotypical child to like not be given sort of like, this is how this works and this is how these things go. But for gifted kids, like living in that ambiguity can often be more comfortable, and more diversity of thought can be more comfortable for gifted kids. And so with that comfort with ambiguity and diversity comes the comfort with fluidity, that you will experience if you're exploring your gender and sexuality. It's often a more accessible conclusion for a gifted kid to conclude that something may be ever changing or that something may be fluid. They're much more comfortable with that kind of ambiguity because it does require these higher level thinking skills, that they may express. The other piece that I think is really true about gifted kids and also neurodivergent kids, and as you know, the overlap between those communities is huge, is that gifted kids are different from neurotypical peers, and they often know that, and they have a sense of being different. And so if I'm already different in some way, it's not that much of a stretch to assume that like maybe other things about me are different. If you are a neurotypical child and you have always sort of fit the cookie cutter mold, it can be really confusing to think that something about you might be different. And so you might be hesitant or even avoid exploring your gender and sexuality. But for a kid who's already different, they've already sort of done the emotional work that it takes to accept that they're different and that there's things about them that are not in line with the norm or that are not typical. And so once they're different in some way, it sort of opens the door to difference in a lot of different ways, which I think is a beautiful thing. Often gifted kids they're sort of open to the idea that there may be more things about them that are different. And so that leads them into the exploration of gender and sexuality, even for gifted kids who may at the end of their journeys identify as cisgender and heterosexual. Like often they still explore the different, like their gender and sexuality more thoroughly than neurotypical peers because they are sort of comfortable with the fact that like something about them might be outside of the norm and that they might have to explore and find their own way. We know that gifted kids are sort of thinking divergently. And one of the ways that like divergent thinking and the social environment interact is that gifted kids are often deconstructing social norms. This is particularly true if you've got a gifted kid who is neurodivergent in a way where they may not feel like beholden to social norms or they may not feel like totally tied to social norms. But even for just gifted kids, they see social norms and can sort of like deconstruct where they came from and often will have a lot of questions or maybe a lot of pieces that they don't agree with and they don't subscribe to. And gender and sexuality, for the most part, is a subject that social norms are really attached to. And a lot of kids, feel like social norms are pressuring them into certain identities. But gifted kids are much more likely to look at a social norm and be like, I don't know if that works for me. I don't know if that makes any sense. Where does that come from? And why do we believe it? Whereas a neurotypical child would be more likely to see a social norm and say, like, okay, that's what I should be. That's what I am. So those are some of the reasons why queerness is more common in gifted people. Um, there certainly are a lot of reasons why queerness is more common in neurodivergent people as well, and we know those communities overlap a lot. But many of the reasons that queerness is common in both of those populations overlap with some of these like different thinking patterns, and the feeling different and being all sort of not beholden to social norms. One piece that I wanted to mention is that we know that mental health and transness are super related. There was a study published in Psychiatry and Clinical Psychopharmacology that found 90% of people with gender dysphoria had a psychiatric diagnosis. And so gender dysphoria being the clinically significant distress that occurs when your sex assigned at birth does not match your gender identity. Um, and so of those 90% of trans people who had a psychiatric diagnosis in this study, 75% of them had ADHD and 25% of them had major depressive disorder. Those are huge, huge numbers of a population to be having a psychiatric diagnosis that would require some sort of support. We know with ADHD specifically, people with ADHD are much more likely to be gifted and talented. And so I imagine that a pretty big chunk of that 75% of trans people with ADHD are gifted. And certainly if we're working with queer kids, whether they're gifted or not, it's important for us to know the way that queerness and mental health intersect so that we can be providing kids with as many services as possible and as many mental health supports as possible as early as we can in their development. So a couple of factors that contribute to the mental health of LGBTQ teens sort of overall. The biggest piece is acceptance. So if children and adolescents are not accepted in their families, if they're not accepted in their communities, if they don't accept themselves, these can all have really big impacts on mental health. And we as providers, as therapists, educators, parents, can be aware of that and can sort of help kids to get to the resources they need, but can also be the accepting person that makes the difference for the child. I read a statistic that I always mention when I'm giving talks of this nature, that the suicide rate for transgender teenagers decreases by 50% if they're affirmed in one or more settings. And so we all have the opportunity as individuals to become that one setting for a child who may not have another setting. If there is a child who lives in an unaccepting community and an unaccepting home whose teacher validates them and whose teacher accepts them for who they are and it affirms their identity, that already has a significant impact on their suicide risk. So it's really important for us to think about the ways in which we're accepting kids. And it's important for us to keep an eye on, like, if we're a parent and we accept our child, am I sending my child to community organizations or groups where they're not being accepted? Are there people in my family who are not accepting my child? And do I want to consider removing my child from unaccepting environments for their mental health, or only allowing my child into accepting environments for their mental health? That can be a really important consideration. Um, I think going along with acceptance of themselves, comfort with their own identity is really important. Sometimes people who are exploring their gender and sexuality feel super comfortable with it, and sometimes they feel super uncomfortable with it. And there's so many things that can impact your own comfort with that journey, and that can impact the way that you relate to that journey emotionally. But there's lots of mental health things that come up. I think anyone who's going on a journey of self-exploration in any way, there's a huge amount of emotional impact, and so that can impact mental health. One huge piece that I think is particularly relevant in schools and community organizations, although is globally relevant, is the access or lack of positive role models. So for queer teens and children who are in a school where there's maybe a queer teacher who's out, or who go to a house of worship where there's like a clergy member who's queer and out about that, having a role model that identifies as queer is hugely important for the mental health of queer teenagers and queer children. Oftentimes I think it can be challenging to find those in certain areas. And if you yourself are a queer person watching this and you're in an educational setting or a community setting, you have the unique opportunities to sort of be that role model for kids. And so that's one of the reasons, like, when I am working with queer teenagers in my private practice, I am always out to them as a queer adult, because I think it's important for them to see that queer adults exist and that other people have gone through this journey before and have gone through some of the ways that it impacts mental health. And just having a positive role model in any way is a helpful thing for a child, but particularly in groups that are oppressed, such as like queer community, having an adult role model is hugely important. I think, similar to the acceptance piece, whether or not the child is being rejected by someone for their identity is really important. That rejection can be like hugely traumatic and have huge mental health impacts. And similarly, like, if the child is experiencing any bullying or harassment, not only is it our responsibility as providers and parents to intervene in bullying and harassment, but also to make sure that we're giving the child whatever support they need to sort of process and cope with the fact that they've experienced bullying and harassment. So, like, particularly if you're in a school, keeping an eye on this kind of thing and making sure your school counselors are well aware and accepting of neurodivergence and queerness and all the various groups, but also keeping an eye out for bullying and harassment that can happen outside of school and that can happen on a playground or in a community group, or really, unfortunately, anywhere that a child can find themselves. So when we know that gifted kids are a lot more likely to be queer, we know that queer people may experience lots of different things that impact their mental health. So, like, what can we do to best support this group now that we have that information? There's a couple of like top tier ways that we can best support this population that I like to mention. The first one is being affirming in general is hugely important. So what that means is that if you work with a child who uses different pronouns or who wants to use a specific name, or who wants to be referred to in a certain way, using the terminology that they identify with is a great way to affirm their identity and to send the message that you've accepted that and that they are worthy and lovable and enough as they identify. Um, for anyone who's in a community where like other people may not be sort of doing that, using that affirming language, if you can do your best to stand up for that in a time where somebody might make a mistake. Um, I think like often I see really great work being done by teachers who are reminding other students of the pronouns of their peers. Parents can do a really great job reminding other family members of the correct language to use, but affirming that no matter how a child identifies, that they are worthy and that they are enough and that they are loved is hugely important for their mental health, for their growth and development, for their sense of self, for everything. So affirming is like a huge banner thing that I want you to get from this presentation. As much as you can affirm a child, and if identities do change and gender and sexuality are so fluid, and so making sure that when kids update you on like, actually now I'd like to use this pronoun, or actually now I use this identifier, doing your best to shift your language and to affirm like, okay, and that hasn't changed, that you are worthwhile to me and that I respect you and that you are enough and you are lovable. In a similar vein, we want kids to feel like they're accepted unconditionally. And so not just accepting that, okay, like you identify this way and that's okay with me and I'm going to use the right language, but making sure that like there are no conditions to this. So oftentimes when I work with families or school staff or people who are working with a queer kid that they maybe were surprised was queer, there is this like condition that like kids have to sort of prove it. Like they have to sort of be queer enough that you then affirm them, or be queer enough that you then are willing to accept them. And we want to make sure that we're accepting kids no matter what. If a child tells you that they use he, him pronouns and you never would have guessed that they use he, him pronouns, like you can accept that without condition and without any sort of proving it or any sort of experience. And if that changes, you can accept that too. So just being unconditionally accepting of any child in any iteration of themselves is super important. I think one trap that sometimes people get caught in, and this is complicated, so I understand, is that it is important to let people be the voice of their own community. And so we want queer people to be the voices that we're listening to when we're learning about queer things, but we don't want to put the burden on someone who has a unique identity to be the educator of everyone. And so for parents and teachers and clinicians, I always suggest being thoughtful about when you ask questions to a child or an adolescent who is talking to you about their queerness versus when you do your own research. So if you have a question about like, which pronoun does this person use, or which one of these words feels like the most affirming for a child, that's a good thing to make sure that you're asking someone before assuming, because it's about their own identity and it's about how they want to be treated, and it can be affirming to ask those questions. If you have a question about queerness, like more generally, oftentimes that's not the time to ask a child who's going on a journey to educate you. And there's lots of great resources online where you can do that educating yourself. So I often recommend to parents, like, see if you can get like a base level of knowledge of the language and of the culture and the history of queerness before you're asking your child to explain those things to you. Because it can often feel like a burden for children and teens to be explaining all of this to people over and over again and having to educate all of the adults in their lives. There is, there will be an exception here or there of a kid who like really loves explaining this kind of stuff or who's particularly academically interested in it. And certainly if that's the case, like you can totally welcome that. But in most cases, I think kids want to be understood, but they didn't necessarily sign up to be our teachers. And so we can do some of our own research. One other piece is that if you make a mistake with terminology, to respond appropriately. I think sometimes people can get pretty defensive if they make a mistake with terminology. On the other end, I think sometimes people can get overly apologetic or bring a lot of attention to the fact that they've made a mistake. And all of these things can make children feel othered, can make them feel sort of outed or called out or vulnerable in a situation. And so if you make a mistake with terminology, my go-to is to correct yourself in the moment. So let's say you are talking to someone who uses they them pronouns, and you say, "Oh, it's his," and you mean, "Oh, I mean it's theirs." To correct and move on so that you don't call a huge amount of attention to the mistake. And then at another time, you can check in with the person and express that you were sorry, or check in on how that may have felt to them. But to correct yourself and then not call a huge amount of attention to it is often the best way to respond. And then I mentioned this piece earlier, but we really want to be talking to kids on their level about identity and not at the level we expect them to be at. So if you have a particularly precocious kid who's talking about gender and sexuality at a higher level, you want to meet them there and you want to be talking to them about the things that they're thinking about. If we talk to kids at a lower level than they're thinking about something, all we do is like push them towards the internet to find like strange answers to their questions. We want to be really open with kids about this kind of thing, because if they're thinking about it, they're going to be learning about it and exploring it, regardless of whether or not we speak to them at their level and regardless about whether or not we accept that. But by being adults who can talk about these things at their level and who can be open with children, it just gives them more safe places to ask questions, more safe places to talk through some of the feelings that come with this journey. And we can expect that like pretty much all gifted kids are doing all sorts of things at different times than we would expect them to if they were neurotypical. That's why they're identified as gifted. Um, so it's important to sort of be aware, like, is my child thinking about this in a little bit of a different way? And can I meet them there and really support them at that place? A couple of things that I think are important for schools to think about. Um, if your health curriculum doesn't cover gender and sexuality at the level that most of your kids are thinking about it, it's not going to be super helpful. And so we want our health curriculums to be differentiated for gifted learning and presented at the age that kids are starting to think about these things. So, like there's often like standardized times when you would start to talk about puberty with fifth graders or whatever it is in your district. Um, you as a teacher or as a clinician like may encounter kids younger than that who are thinking about these things, and they deserve access to the knowledge, they deserve access to information, they deserve access to supportive adults who can talk to them about these things. And so I think just like keeping your ear to the ground in your classrooms or with the kids that live in your home or that you work with, if these topics are starting to come up and if they're starting to talk about it amongst themselves, it's important that we as educators give them the information that they need to really explore their gender and sexuality in a safe and healthy way. So often that means adjusting health curriculums. Often that means maybe starting certain pieces of health curriculums earlier. One way that you can do this if you have a school where kids are sort of in different places is with peer affinity spaces. So we talked a little bit about how role models are super important. It's also super important for kids to have peers who are going through the same thing as them. Making a space for queer kids to come together and to talk about their experiences and to be supportive for each other is super impactful on their mental health. And then as educators, you can use that peer affinity space as a space to talk about some of the knowledge and information that they may not be learning yet in school. I really recommend, if it's at all possible, that an affinity space for queer kids be run by a queer adult. If it's not at all possible, certainly finding the most affirming, allistic person in the school, and maybe bringing in some outside community members who could serve as role models could be a helpful suggestion. But the more that kids are surrounded by people who are like them, the more accepting they're going to be of themselves, and the more their self-esteem will continue to be positive. But this section is just like the three biggest questions that I get from parents, from teachers, from other clinicians, from everyone. The biggest questions that I get when I talk about queerness in children and teens. Perhaps the most common question that I get, particularly from parents, is this just a phase in my child's life? And the short answer to that is maybe. I don't know that it totally matters for us to find out if it's a phase for your child, because let's say your child is going through a phase and they're really not actually queer. By accepting them and affirming them and allowing them to explore their gender and sexuality, we improve their sense of self and we show them that we love them unconditionally in any iteration. So whether or not this is a phase for your child doesn't really change the way that I would recommend you respond. And then if your child is queer and you've responded to them as if they're just going through a phase, that can be incredibly invalidating and really ruin a relationship between a parent and a child. So we want to use this opportunity if a child exploring their gender and sexuality as an opportunity to flex our validation skills, as an opportunity to show children that they are loved and they are accepted in any iteration. And truthfully, when a child is exploring their gender and sexuality, doesn't necessarily mean they're queer, but all children explore their gender and sexuality. All teenagers explore their gender and sexuality in different ways. They have a lot of language now because of the queer community to describe some of the things that they're thinking about or experiencing. And it's important that like we don't need to totally be on the hunt for like what exactly is my child's identity going to be. Like we may never figure it out. Your child might have a fluid identity forever. And going on the hunt for like what is really true is not totally important. It's more important to let your child experience their journey and to demonstrate at any turn that you support them and you accept them and you love them and you validate them. Another question I get all the time is, are kids doing this just to fit in? I think it was a really interesting question to me the first couple of times I got it because I found like, why would kids be doing something that is sort of not a social norm to fit in? But as queer communities are growing and as children and adolescents are learning more and more about queerness, like the numbers of kids who identify as queer are getting much, much larger in younger grades in schools. And so it's possible, especially if you're in like a neurodivergent environment or a gifted environment where even more people are likely to be queer, that there could be some peer pressure for kids to be queer to fit in with a certain group of people. Um, I think that the same way that we would respond to a child who maybe is trying on a different type of personality to try and fit in with a different group. Like we want children to feel like it's okay to explore different things and that it's okay to be who they are, no matter where they end up. If your child is exploring and they use a different name for a while and then they eventually go back to their original name, like you haven't harmed them by using whatever name they have asked you to. All you've done is shown them that you respect them and that you accept them as they are. I think kids do a lot of different things to fit in. And ultimately, as they get older, they learn how to individualize themselves and how to not let peer pressure impact them. And we, as clinicians, as educators, as parents, can really bolster a kid's self-esteem and their ability to, not fall victim to peer pressure by accepting them in any version. Um, and then this is, the biggest question that I get, particularly from providers. What should I say if I use the wrong pronoun or name by mistake? I already talked a little bit about this, but saying oops and correcting yourself and moving on in the moment is really important. Apologizing profusely can sort of set up an expectation for someone to say it's okay when it really might not be okay. And it is totally reasonable that they don't feel okay about that. Calling attention to it can be like really outing for someone. And then getting defensive is just like totally invalidating and shows that you don't respect a child's identity. Um, I I will say that this particular the answer to this question is not an original thought of my own. I worked with a group of queer and neurodivergent teenagers who came up with this policy, like they wished all adults would know this. And in every group I've worked with, I've sort of thrown it out to the group, and almost always queer teenagers agree with this policy. So it's crowdsourced, but that's generally best policy. If you want to learn a little bit more about the neurodiversity piece of of queerness and how it interacts with neurodivergence, you can listen to the neurodiversity podcast. I did an episode on there, specifically about neurodivergent people who are queer. I also mentioned that I'm writing a book. So if you're interested in that book, if you work in a school or work with queer teenagers, you can join my mailing list. And then if you want to get in touch with me in any way, I'll leave up my digital business card for a few moments. And you can sort of get my contact that way. I'm happy to talk to people about their communities or any ways that I can help and support. I'm always available.
Excellent. Thank you so much. That was amazing. I think the big message I took away is affirm, affirm, affirm.
That's the right takeaway.
One question that did come up is, I know we were talking before the session too, but thinking about this, and I know you touched on it a little bit, um, with the neurodivergence and the queerness, so many of the people who watch Conversations with KIT are practitioners. And so thinking about that in our 2E students, what in particular might be some of like the needs or takeaways that unique systems of support that they might need, being neurodivergent as like a 2E learner? What
Yeah,
would
sure.
you propose?
Um, so I think like we know that 2E learners and as neurodivergent people in general, like one of the big supports that they benefit from can be like social emotional learning, whether that's therapy, whether that's in group. Sometimes social emotional things do not come naturally to neurodivergent people and they need to be directly taught. Um, and if we can add queerness into our social emotional curriculum, that can be super important. So, like the social dynamics and the social rules in a queer environment might be different than in a not queer environment. There might be different language that you're expected to use. There might be different boundaries. And giving kids access to that information and educating them about it the same way that we would educate them about learning from people who are from different countries or from people who have other different identities. Um, we want to make sure that queerness is a piece of that because so many of them are likely to be queer. Um, and then I think if you're in a neurodivergent community or a 2E community, like knowing that this is going to come up and being prepared with an affinity space or a differentiated health curriculum, or with some role models in your community, even before kids start asking for that can be really important. I think any sort of 2E or neurodivergent place should be aware of the fact that they're going to have queerness walking through their door and that they should be accepting of that and have sort of information available for kids and role models of that kind.
So yeah, and then building on that, knowing that everyone should be ready to have neurodivergent, gifted, queer students coming through their doors, then what would be your, because again, we have a lot of practitioners here, advice for starting some sort of group in a setting like that to make sure that these students are affirmed within the educational setting. So like a GSA type thing, like a Gay Straight Alliance. I don't know if you've talked to the kids you work with and have crowdsourced kind of what might be the best place to start, or if you get that question a lot, but just for our listeners.
Totally. I think it depends on your community. I'm not a huge fan of the Gay Straight Alliance specifically because I think it just doesn't really encompass enough different people. But I've heard a lot of schools rename it the Gender and Sexuality Alliance, and that tends to be more inclusive. Um, I think if you're in a school where you can have something like a club, that can be really great, especially if you have a queer leader for the club. I worked at a very small school many years ago where I ran the queer club. Um, and we had an awesome time. Like it was just like me and any kid who felt like walking through the door talking about what it's like to be queer, and what experiences they were going through. And a lot of what I talk about now are things I've learned from those kids. So I think that kind of thing can be really important. Having a queer leader, if at all possible, is great. If it's not possible, finding someone allistic, and finding someone who maybe is connected to the queer people in your community, so that they can get that role model piece is important. And I think certain schools can run these like during the school day, whether it be at lunch or whether it be like an elective period. That can be really nice for kids who maybe aren't accepted at home, but still deserve access to these affinity spaces. I know like one school that I work with who has like a period of the day that is for enrichment clusters, which is a gifted thing. And one of the enrichment clusters became a queer affinity space. And like that was a really beautiful way for kids to enrich their learning and have access to that without necessarily having to be out at home. For practitioners who don't work in schools, um, I've run several queer and neurodivergent therapy groups and found that it's a really successful intervention for those kinds of kids. I think the group aspect can really help with um, bolstering self-esteem and with kids feeling othered or with kids feeling like they don't belong. Having peers can be really helpful. And then when I ran these groups, I ran one, for example, with myself and another practitioner, and I was very clear from the beginning of the group that I identifying myself as queer so that they knew they were sort of like in a safe space, they could talk about things, and that somebody would understand what they were going through. So I think group therapy is like also a really cool way to get that kind of thing done if you're not in school. Yeah, I hope that answers that question.
100% does. Thank you so much. And with that, we are going to go ahead and end our conversations with CAGT. Julia, thank you so much for sharing just all of your knowledge and expertise with us. And thank you to everyone who joined us here this evening. Thanks.
Thanks, everyone.
And